ಓಕೆ ಸರ್, ನೀವು ತುಂಬಾ ಪ್ರೊಸೆಸ್ ಬಗ್ಗೆ ಎಲ್ಲ ಹೇಳಿದ್ರಿ, ವಿತ್ ಮೆಡಿಕಲ್ ಆಗಿ ಹೇಗೆ ಪ್ರೊಸೀಜರ್ ಎಲ್ಲ ನಡೆಯುತ್ತೆ ಅಂತಲ್ಲ. ನಾವು ಗೋಯಿಂಗ್ ಬಿಯಾಂಡ್ ಮೆಡಿಕಲ್, ಲೈಕ್ ಅದರ್ ಆಸ್ಪೆಕ್ಟ್, ಜನರಿಕ್ ಕ್ವಶನ್ಸ್ ಆದ್ರೂ ಸ್ವಲ್ಪ ಕ್ರಿಟಿಕಲ್ ಥಿಂಕಿಂಗ್, ಕಾಂಟ್ರವರ್ಷಿಯಲ್ ಕ್ವಶನ್ಸ್ ತರ ಎಲ್ಲ ಬರ್ತಾ ಇದ್ದೀನಿ. ಐ ವಾಂಟ್ ಟು ನೋ, ಈಗ ವೇರ್ ವಿ ನೋ ಅ ಪರ್ಸನ್, ನನಗೆ ಗೊತ್ತಿರೋರು ಒಬ್ರು, ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಹುಡುಗಿ ನೋಡಕ್ ಹೋಗಿದ್ದ ಹುಡುಗ, ಆ ಹುಡುಗಿ ಕಡೆಯವ್ರೇನೋ ಒಪ್ಕೊಳ್ಳಿಲ್ಲ, ಏನೋ ಆಯ್ತು, ಏನೋ there was not, and that guy felt that girl's ಸ್ವಲ್ಪ attitude was not matching, and he said ನನಗೆ ಯಾಕೋ ಹುಡುಗಿ attitude ಮ್ಯಾಚ್ ಆಗ್ತಾರೆ, ಐ ವಾಂಟ್ ಟು ವಿತ್ಡ್ರಾ ಅಂದಾಗ ಹುಡುಗಿ ಅವ್ರ ಅಮ್ಮ ಹೇಳ್ತಾರೆ, ಫಸ್ಟ್ ಹುಡುಗನ ತಲೆ ಮೇಲೆ ಕೂದಲು ಬೆಳೆಸ್ಕೊಳಕ್ ಹೇಳು ಅಂತ. ಅಂದ್ರೆ ಹೌ ದೇ ಡೂ ದಿಸ್, ಅಂದ್ರೆ ಹೌ ದೇ ಡೂ ಇಟ್ ವಿತ್ ಎ ಕ್ಯಾರೆಕ್ಟರ್. ಅಂಡ್ ವೆನ್ ಇಟ್ ಕಮ್ಸ್ ಟು ಮ್ಯಾರೇಜ್ ಎಸ್ಪೆಷಲಿ, ಓ ನೋ ಯು ಡೋಂಟ್ ನೋ, ಹುಡುಗನ ತಲೆ ಮೇಲೆ ಸ್ವಲ್ಪ ಕೂದಲು ಕಮ್ಮಿ ಬೇಡ ಅಂತ ಹೇಳ್ತಾರೆ, ಹುಡುಗಿ ಸ್ವಲ್ಪ ದಪ್ಪ ಇದ್ದಾಳೆ ಸರಿಗಿಲ್ಲ ಅಂತ ಹೇಳ್ತಾರೆ, ಅಥವಾ ಅವಳು ಯಾಕೋ ಸ್ವಲ್ಪ ಯು ಹರ್ ದಿಸ್ ಒನ್ ವೆದರ್ ಇಟ್ಸ್ ಅ ಬಾಡಿ ವೆಯ್ಟ್ ಆಗಿರ್ಲಿ ಇದು ಸರಿಗಿಲ್ಲ ಅಂತ. ಹುಡುಗಿಗೆ ಕೆಲವೊಮ್ಮೆ ಫೋರ್ ಹೆಡ್ ಮುಂದೆ ಇದ್ದಾಗ ಹೇಳ್ತಾರೆ, ಅಥವಾ ಹುಡುಗರಿಗೂ ಅಷ್ಟೇ ಫೋರ್ ಹೆಡ್ ಸ್ವಲ್ಪ ಮುಂದೆ ಇದ್ದಾಗ ಇಲ್ಲಿ ಕೂದಲಿಲ್ಲ ಅಂತೆಲ್ಲ ಹೇಳ್ಬಿಟ್ಟು ದೇ ವಿಲ್ ಬಿ ಮೇಕಿಂಗ್ ಫನ್ ಆಫ್ ಇಟ್, ಅಂಡ್ ಲಾಟ್ ಆಫ್ ಟೈಮ್ಸ್ ಮ್ಯಾರಿಟಲ್ ಡಿಸ್ಕಾರ್ಡ್ಸ್ ಆಗುತ್ತೆ, ಈ ಥರ ಎಲ್ಲ ಆಗುತ್ತೆ. ಜಸ್ಟ್ ವಾಂಟ್ ಟು ನೋ, ಹ್ಯಾಸ್ ಎನಿ ಆಫ್ ದ ಕೇಸಸ್ ವೇರ್ ಪಾರ್ಟ್ನರ್ ಹ್ಯಾಸ್ ಫೋರ್ಸ್ಡ್ ದೇರ್ ಸ್ಪೌಸ್ ಆರ್ ದೇರ್ ಪಾರ್ಟ್ನರ್ to get into plastic surgery, pressure ಮಾಡಿರೋದಿದ್ಯಾ?
Yes, we do get cases where patient wants cosmetic enhancement to keep the relationship alive with the husband, to avoid extramarital affairs. Yes. And to cosmetic procedures to enhance the sexual well-being, sexual relationship. So one thing which I want to point here is, unless it is scientifically needed or ethically needed, medically needed, don't push yourself into these surgeries, because sometimes they can lead to social
life-threatening
conflicts and all. I have had a patient who wanted filler. The procedure was filler andre it's a natural gel-like substance which we inject to restore the volume. Under eye tear troughs ಅಂತ ಹೇಳ್ತೀವಿ, under eye ಅಲ್ಲಿ ಡಿಪ್ರೆಷನ್ ಇರುತ್ತೆ, we use a natural it's hyaluronic acid, usually gel-like substance, which we inject to restore the volume and to give a better contour. She was not, though done medically, in a correct way, and pre-op, post-op photographs showed that the deformity has been corrected. The patient was not happy. The husband called me and said, like, you have not done it correctly. And I had to share the pre-op and post-op photos to the husband. Sometimes due to peer pressure, when we or other influences by a friend or a partner, we shouldn't do surgery on a patient unless they themselves are physically motivated. We can restore the anatomy, change the anatomy, give the shape they wanted, but we can't reshape their inner battles mentally. We can't do any surgery to they have some struggle or self-esteem problems, body dysmorphic disorders, where they will not be fully pleased.
No, that we could definitely see, because body shaming agli it has become a very common norm.
Yes.
Jana when they cannot attack them with their intellectual or anything, when they cannot offend them with intellectual thing, they usually take up the sides of body shaming. Correct. And that would be a lot of low self-esteem issues agi.
To add that one thing, if some partner is looking for a better partner in terms of getting a hair transplantation or a breast augmentation or a liposuction and all, probably this is they are having a low thinking mindset, and people are to be judged by their character, by their personality rather than body appearance.
So
True. So change the partner, or don't
change yourself.
change yourself.
Good.
Yes.
So I think ಸರಿಯಾದ ಪಾರ್ಟ್ನರ್ನ ಹುಡುಕಿ ಬಿಫೋರ್ ಸೆಲೆಕ್ಟಿಂಗ್ ಅ ಸರಿಯಾದ ಡಾಕ್ಟರ್. ದಟ್ ಈಸ್ ಇಂಪಾರ್ಟೆಂಟ್.
That is important. True.
Very good. That is very important. And
Yes.
and unfortunately, because of this Instagram thing where people have used lot of things on fillers ಆಗಿರ್ಬೋದು ಎಲ್ಲ, ಜನಕ್ಕೆ ಐ ಫೀಲ್ ಪರ್ಸನಲಿ ವೆನ್ ದೇ ವಾಂಟ್ ಟು ಸೆಲೆಕ್ಟ್ ಅ ಪಾರ್ಟ್ನರ್, ನನಗೆ ಆ ಪಾರ್ಟ್ನರು ನನ್ನ ಇನ್ಸ್ಟಾಗ್ರಾಮ್ ಪೋಸ್ಟ್ ಅಲ್ಲಿ ಎಷ್ಟು ಚೆನ್ನಾಗಿ ಕಾಣ್ತಾರೆ ಅನ್ನೋದೇ ಇಂಪಾರ್ಟೆಂಟ್ ಆಗಿರುತ್ತೆ ಅವ್ರಿಗೆ.
True.
ಸೊ ಅವ್ರೇನ್ ಮಾಡ್ತಾರೆ, ಅವ್ರ ಪಾರ್ಟ್ನರ್ ಚೆನ್ನಾಗಿರೋದೇ ನೋಡ್ತಾರೆ, ಅಥವಾ ಅವ್ರ ಪಾರ್ಟ್ನರ್ ಸರಿಗಿಲ್ಲ ಅಂದ್ರೆ ದೇ ಆರ್ ವೆರಿ ಹೆಸಿಟೆಂಟ್ ಟು ಪುಟ್ ಅ ಪಿಕ್ ಆಫ್ ದೇರ್ ಪಾರ್ಟ್ನರ್ ಆನ್ ಇನ್ಸ್ಟಾಗ್ರಾಮ್. ಅಥವಾ ಇನ್ಸ್ಟಾಗ್ರಾಮ್ ಕರೋಸಲಲ್ಲಿ 5th or 6th ಪಿಕ್ ಹಾಕಿರ್ತಾರೆ. ಫಸ್ಟ್ 2 ಪಿಕ್ಸ್ ಅವ್ರದೇ ಹಾಕಿರುತ್ತೆ, ನೆಕ್ಸ್ಟ್ ಅಲ್ಲಿ ಹಾಕಿರ್ತಾರೆ. ಸೊ ಇಟ್ಸ್ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ ಟು ಲುಕ್ ಇನ್ ಟು ದಟ್. ಇದು ಒಂದು ಪಾರ್ಟ್ನರ್ ಅಂಡ್ ಸೆಕ್ಷುವಲ್. ಅಂಡ್ I think this is also biological, sir, because Darwin said the attraction of another person will usually be first, it will be a physical attraction.
True.
But Darwin ಕಾಲದಿಂದ now we have intellectually evolved. So ನಮಗೆ ಗೊತ್ತು ಈಗ ಸಂಸಾರ ಮಾಡಲಿಕ್ಕೆ ಅಥವಾ ಒಂದು ರಿಲೇಶನ್ಶಿಪ್ ಅಲ್ಲಿ ಇರಲಿಕ್ಕೆ ಈ ಫಿಸಿಕಲ್ ಅಪಿಯರೆನ್ಸ್ ಗಿಂತ ಬಿಯಾಂಡ್ ಬೇಕು ಅಂತ. ಓಕೆ, ನೆಕ್ಸ್ಟ್ ವಿಚ್ ಅಗೇನ್ ಕಮಿಂಗ್ ಬ್ಯಾಕ್ ಟು ದಿಸ್ ಸೈಕಾಲಜಿಕಲ್ ಥಿಂಗ್ ವೇರ್ ಒಬ್ಬ ಪಾರ್ಟ್ನರ್ಗೆ ಇರುತ್ತೆ, ಕೆಲವೊಮ್ಮೆ ಜನಕ್ಕೆ ಲೋ ಸೆಲ್ಫ್ ಎಸ್ಟೀಮ್ ಇರುತ್ತೆ. ಈಗ ಸೈಕೋ ಸೈಬರ್ನೆಟಿಕ್ಸ್ ಅಂತ ಒಂದು ಪುಸ್ತಕ ಇದೆ ವೇರ್ ಇಟ್ ಇಸ್ ರಿಟನ್ ಬೈ ಅ ಪ್ಲಾಸ್ಟಿಕ್ ಸರ್ಜನ್. ಆತ ತನ್ನ ಪ್ಲಾಸ್ಟಿಕ್ ಸರ್ಜರಿಗಿಂತ ಹೆಚ್ಚಿಗೆ ಅವ್ನು ಮಾಡೋದಿದ್ದು, ಜನ ಅವ್ರಿಗೆ ಪ್ಲಾಸ್ಟಿಕ್ ಸರ್ಜರಿ ಮಾಡಿ ಅವರ ಬಾಡಿ ಶೇಪ್ ಎಲ್ಲ ಚೇಂಜ್ ಆಗಿದ್ರು ಸಹ ದೇರ್ ವಿಲ್ ಸ್ಟಿಲ್ ಬಿ ಲೋ ಸೆಲ್ಫ್ ಎಸ್ಟೀಮ್ ಇರುತ್ತೆ. ಏನೇ ಮಾಡಿದ್ರು ಅವ್ರ ಆಂತರಿಕವಾದಂಥ ಪರ್ಸನಾಲಿಟಿ ಇನ್ನೂ ಚೇಂಜ್ ಮಾಡ್ಕೊಂಡಿರಲ್ಲ. ಅದ್ರ ಬಗ್ಗೆ ಯು ಕ್ಯಾನ್ ಟೆಲ್ ಎನಿಥಿಂಗ್? ಹೌ ಡು ಯು ಪ್ರಿಪೇರ್ ಮೆಂಟಲಿ ಫಾರ್ ದ ಪೀಪಲ್?
ಕಾಸ್ಮೆಟಿಕ್ ಸರ್ಜರಿ ಮಾಡಲಿಕ್ಕೆ there are certain indications. They should have emotional maturity, also biological maturity. We do certain procedures when they have crossed more than 18 years of age. And rhinoplasty, for example, facial skeletal growth ಆಗಕ್ಕೆ ಕಂಪ್ಲೀಟ್ ಆಗಕ್ಕೆ 15 to 17 ಇಯರ್ಸ್ ಬೇಕು. ಅದಾದ್ಮೇಲೆ ನಾವು ಬೋನ್ನ ಆಲ್ಟರ್ ಮಾಡ್ಬೋದು, ಶೇಪ್ನ ಆಲ್ಟರ್ ಮಾಡ್ಬೋದು. ಯಂಗ್ಸ್ಟರ್ಸ್ ಹೂ ಕಮ್ seeing the Instagram trends and all, we have to ethically refuse them that once you attain 18 years of age, we do these procedures. Emotional maturity is very important. They should buy surgery from us rather than you force surgery upon them.
True.
Yes.
True. Because ನಾವು ಎಷ್ಟೇ ಇದನ್ನ ಮಾಡಿಸಿದ್ರು ಕೆಲವೊಮ್ಮೆ ದರ್ ಅನ್ಸ್ಯಾಟಿಸ್ಫೈಡ್. ಬಿಕಾಸ್ ಅವ್ರಿಗೆ ಎಷ್ಟೇ ಮಾಡೋದು ನಾನು ಯಾವುದೋ ಒಂದು ಐಡಿಯಲ್ ಪರ್ಸನ್ ಅಥವಾ ಐಡಿಯಲ್ ಸೆಲೆಬ್ರಿಟಿ ಹಿಡ್ಕೊಂಡು ಬಂದಿರ್ತಾರೆ ಮೈಂಡ್ ಅಲ್ಲಿ.
Correct. This is to add to your this thing. Certain people get photos that I want this transformation. We always safely tell patients that be realistic, be practical. Your body type is different, your bone structure is different, your anatomy is different, food habits are different, skin type is different. So I can better this,
but
which enhances with your facial harmony or body proportions. So it is all about restoring proportions and keeping it natural rather than giving them a exaggerated result.
Michael Jackson.
Yes.
Michael Jackson is actually ತುಂಬಾ ಇದನ್ ಮಾಡ್ಕೊಂಡು ಪ್ಲಾಸ್ಟಿಕ್ ಸರ್ಜರಿ, ವೆದರ್ ಇಸ್ ರೈನೋಪ್ಲಾಸ್ಟಿ ಆಗಿರ್ಬೋದು, ದ ಚೇಂಜ್ ಆಫ್ ಹಿಸ್ ಕಲರ್. ಹಿ ವಾಸ್ ಬೈ ಬರ್ತ್ ಹಿ ವಾಸ್ ಬ್ಲಾಕ್, ದೆನ್ ಅವ್ರದ್ದು ಸ್ಕಿನ್ ಟೋನ್ ನ ಚೇಂಜ್ ಮಾಡ್ಕೊಂಡು he underwent a lot of things.
To correct you, no, he didn't undergo any procedures. He had a medical condition, skin condition called vitiligo, where there is loss of melanin and skin becomes white in color. There is no a permanent molecule to permanently change your skin tone color.
Is it so?
No. Yes. Lot of people, tell antioxidants, glutathione and all, injectables, IV medications, topical application.
ಯಾರು ಬೆಳ್ಳಗ್ ಮಾಡಕ್ಕಾಗಲ್ಲ.
Can change their color or decrease the darkened spots to lighten it by 1 shade or 2 shades. There is no molecule in this earth to permanently change your original skin tone color.
No, because people are so obsessed over the white European colors.
Yes.
Sorry, West
it's
color.
all genetically. It's all genetically got or inherited from their parents.
Unfortunately, even your cosmetic creams are adane sell ಮಾಡ್ತಾರೆ. Glow, Fair and Lovely. They wanted to put fair there. ಸೊ ಆ ಥರ ಇಷ್ಟೊಂದು ಮಾಡ್ತಾ ಇರ್ತಾರೆ.
Yes.
Like you said, they can never change the color. Because I heard there was one Kannada actress, ಆಕೆ ಒಂದು ಇಂಜೆಕ್ಷನ್ ತೊಗೊಂಡ್ಬಿಟ್ಟು ಬೆಳ್ಳಕ್ಕಾಗ್ಬಿಡುತ್ತೆ ಅಂತ ಮಿತ್. ಐ ಆಮ್ ನಾಟ್ ಶೋರ್. ಇಟ್ ಇಸ್ ಅ ಮಿತ್.
It's antioxidant, yeah, as you said, antioxidant, glutathione, IV injections give you a temporary glow.
Again,
Yes. We should remember this fact that skin turnover cycle ಅಂತ ಇರುತ್ತಿಲ್ಲ, skin regeneration cycle. It is about 21 to 27 days. ನಮ್ದು ನಾರ್ಮಲ್ ಸ್ಕಿನ್ ವೈಲ್ ಟೇಕಿಂಗ್ ಬಾತ್, ಸ್ನಾನ ಮಾಡೋಕ್ಕಲ್ಲಿಗೆ ದ ಟಾಪ್ ಮೋಸ್ಟ್ ಲೇಯರ್ ಆಫ್ ದ ಸ್ಕಿನ್ ಬಿದ್ದೋಗುತ್ತೆ. ಹಾವಿನ ಪರೆ ಹೆಂಗ್ ಬಿದ್ದೋಗುತ್ತೆ ಹಾಗೆ ನಮ್ದು ಬಿದ್ದೋಗುತ್ತೆ. ಸೊ ಅಗೇನ್ ಯು ಆರ್ ಬ್ಯಾಕ್ ಟು ಸ್ಕ್ವೇರ್ ಒನ್. ಸೊ ದೀಸ್ ಕಾಸ್ಮೆಟಿಕ್ ಟ್ರೀಟ್ಮೆಂಟ್ಸ್ ಹ್ಯಾವ್ ಟು ಬಿ ಡನ್ ಆನ್ ಎ ರೆಗ್ಯುಲರ್ ಬೇಸಿಸ್. ದೇ ಹ್ಯಾವ್ ಟು ಬಿ ಮೇಂಟೈನ್ ಟು ಲುಕ್ ಗುಡ್ ಅಂಡ್ ಟು ಹ್ಯಾವ್ ಎ ಗುಡ್ ಗ್ಲೋಯಿಂಗ್ ಸ್ಕಿನ್.
ನೀವು ಇದು ಮೆಂಟಾಲಿಟಿ ಬಗ್ಗೆ ಹೇಳ್ತಾ ಇದ್ರಿ ಅವಾಗಲೇ, ಈ ಥರದೆಲ್ಲ ಪಾರ್ಟ್ನರ್ ಆಗಿರ್ಬೋದು, ಸೆಲ್ಫ್ ಆಗಿರ್ಬೋದು, ಅದ್ರ ಬಗ್ಗೆ ಇಫ್ ಯು ಕ್ಯಾನ್ ಎಲಾಬರೇಟ್ ಮೋರ್.
Emotional maturity usually comes when they complete their studies and they are doing jobs, they are earning, and they know how the process of cosmetic surgery is done. So as I said earlier, we do these corrections only when they are emotionally mature to undergo these procedures, and also they are at the right biological age, usually adults more than 18 years. There is a condition called as body dysmorphic disorder, when whatever surgery and the result, good result we give, they will be mentally dissatisfied and they keep on approaching many other surgeons for betterment of the result.
It's another different topic, but I would like to ask, all over the world plastic surgery is happening. North Korea is called the capital of plastic surgery or aesthetic surgery, cosmetically. ನನಗೆ ಪೀಪಲ್ ಇನ್ ಇಂಡಿಯಾ ಆರ್ ಒಬ್ಸೆಸ್ಡ್ ಓವರ್ ಕೊರಿಯನ್
Beauty care,
skin care and everything, but they don't know half of the population has undergone this plastic surgery. So North Korea is known for usually the jawline, sharp jawline ಎಲ್ಲ ಬರುತ್ತಲ್ಲ, and they're famous for it. And Turkey, people have gone for medical tourism ಅಂದ್ಬಿಟ್ಟು ಟರ್ಕಿಗೆ ಹೋಗ್ತಾರೆ. ಅವ್ರು ದೇ ಬೀನ್ ಫ್ಲಾಗ್ ಬೇರರ್ಸ್ ಫಾರ್ hair transplant ಅಂತ. Brazil also, there is something called as Brazil butt lift. Which they keep doing it. And Thailand, which is also known for liposuction and
gender reassignment surgery.
Yeah,
in Thailand it happens.
Oh, is it so? Okay, yes. This I didn't know. Yes. Okay, so ಈ ತರದೆಲ್ಲ ಇದ್ದಾಗ ನಮ್ಮ ಇಂಡಿಯಾದಲ್ಲಿ ಸರ್, ನಮ್ಗೇನಾಯ್ತು ಸ್ಪೆಸಿಫಿಕಲಿ ಇದೆಯಾ ನಮ್ಮ ಇಂಡಿಯಾ ಪ್ಲಾಸ್ಟಿಕ್ ಸರ್ಜರಿನಲ್ಲೂ? ಹ್ಯಾವ್ ವಿ ಎವಾಲ್ವ್ಡ್ ಆರ್ ವಿ ಆರ್ ಕಾಪಿಂಗ್ ದ ಸೇಮ್ ಪ್ರೊಸೀಜರ್ ಆಫ್ ದೆಮ್?
See, I would also want to tell you that the father of ancient plastic surgery is our own Sushruta. Back in 600 BC, in Takshashila in northern India, he used to use a cheek flap to reconstruct nose. ಅವಾಗೆಲ್ಲ ಏನೋ ರಾಬರಿ ಆದರೆ ನೋಸ್ ಕಟ್ ಮಾಡೋ ಟ್ರೆಡಿಷನ್ ಇತ್ತು. So he was the one to do first time in the history of mankind plastic surgery. So his secrets were stolen by the other people, Greek ಆಗಿರ್ಬೋದು, ರೋಮನ್ ಆಗಿರ್ಬೋದು. But as I said, the modern evolution of plastic surgery happened during World War I and World War II, during 1920s, 1940s.
Sushruta ಇಲ್ಲಿಂದ ಸ್ಕಿನ್ ತಗೊಂಡು ಇಲ್ಲಿ.
Yes, there is a small local advancement where we use a cheek flap to cover the nose. And we also use a forehead skin to reconstruct the nose.
Wow,
they are all called pedicle flaps. Yeah.
Wow. Yes. Mostly Sushruta ರಾಮಾಯಣ ಕಾಲದಲ್ಲಿ ಇದ್ರೆ ಶೂರ್ಪನಖಿ would have got a good rhinoplasty.
Yes. We nowadays do a very good amount of reconstructive surgeries, be it accidents, burn contractures, be it microsurgery, be it diabetic foot ulcer treatment.
So medically
India is
plastic more powerful in
reconstructive. We also have very good aesthetic practice in metropolitan cities. The good thing about Indian plastic surgeons is we have very good English speaking capability to attract a lot of medical patients abroad. And nowadays the corporate hospitals have very good cutting edge tools to deliver the very good aesthetic results and reconstructive results.
Okay.
Yes.
But what is this medical tourism anta ಮಾಡ್ತಾರೆ sir?
Medical tourism is like you going to other country which is known or famous for a certain kind of cosmetic surgery. As you said, a lot of people go to Turkey for hair transplantation. Brazilian butt lift is very famous, probably due to because the youngsters hit the beach during their puberty and they want to physically look good in a bikini. So the lot of liposuction happens in Brazil. See, the it is always good if you choose the right place, right surgeon who is board certified, qualified, and who has consistently delivered results. But the downfalls also, we should not, get attracted to the low cost or low cost package deal. The immediate complications might not be handled well because the person comes back from the country.
Okay,
Yes, the good follow-up might not be there. So these are the downfalls which one should be ready to take into account while opting for plastic surgery in a different country or a different place.
ಸ್ಪೀಕಿಂಗ್ ಅಬೌಟ್ ನೀವು ಅವಾಗಲೇ ಹೇಳಿದ್ರಿ ಬಟ್ ಲಿಫ್ಟಿಂಗ್ ಅಂದ್ಬಿಟ್ಟು
Yes,
ಗೋ ಫಾರ್ ಬೀಚ್ ಅಂತಲ್ಲ. ಐ ರಿಮೆಂಬರ್ ದರ್ ಹಸ್ ಬೀನ್ ಅ ಟ್ರೆಂಡ್
Yes.
ಒಂದ್ ಕಾಲದಲ್ಲಿ ಟ್ರೆಂಡ್ ಇತ್ತು ಹ್ಯಾವಿಂಗ್ ದಿಸ್ ಕಾರ್ಡಿಶಿಯನ್ ಎಫೆಕ್ಟ್ ಅಂತ ಮಾಡೋರು ಅಂಡ್ ಅಥವಾ ಈ ಝೀರೋ ಫಿಗರ್ ಆರ್ ದೇ ವಿಲ್ ಹ್ಯಾವ್ ಅ ಪ್ರಾಪರ್ ನಂಬರ್ 36, 24, 36 ತರ ಇರಲೇಬೇಕು ಅಂತ ಇರುತ್ತೆ.
This is real. This is real. A lot of youngsters are getting influenced by this. Influencers are talking about cosmetic procedures openly on social media, and they have also been paid to promote certain kind of surgeries.
Oh.
Yes, and due to as a lot of exposure in social media for the youngsters, teenagers, they feel that they also want to have cosmetic surgeries. The trend which was infamous because of Kim Kardashian was to have a natural curve and a
ವೈನ್ ಶೇಪ್
and have a good hip waist ratio, and normally the ideal one can be attained by liposuctions, but it's not always good to have that.
Follow.
In earlier days, probably in 2010s, there was a trend to have massive transformations. People used to opt for bigger breast implants to look better. There were a lot of surgical techniques to achieve that results, but nowadays the trend is towards looking natural, looking proportional. Minimal intervention, minimal downtime, and lot of injectables, botox, fillers. There is also called as prejuvenation, when you arrest the changes prior before they get established by getting a little amount of micro botox to keep the skin to avoid aging.
One more
in
thing
earlier time.
which I wanted to know, like
Yes.
you were speaking, Thailand ಅಲ್ಲಿ they're into gender
Yes.
ಇದನ್ನ ಅಂತ ಎಲ್ಲ ಹೇಳ್ತಾ ಇದ್ರಿ. ನಮ್ಮ ಇಂಡಿಯಾದಲ್ಲೂ ನಾವು ಲಾಟ್ ಆಫ್ ಪೀಪಲ್ ವಾಂಟ್ ಟು ಚೇಂಜ್ ದೇರ್ ಜೆಂಡರ್ ಅಂತ
Yes,
ಬರುತ್ತೆ. Have
yes.
you undergone any case? Because ಅಲ್ಲಿ ಲಾಟ್ ಆಫ್ these things gets added when you change the gender.
Yes, they are. There is a difference between mentally aligned with one gender. Physically, they have one more gender.
Okay.
Adre somebody who is a male who mentally thinks she is a female. Okay, she wants to get rid of the external genitalia, which is of course of a man. They want a gender reassignment surgery. There are strict rules and regulations for it. We have to have a psychiatric consultation, evaluation, and they have to consult legally because the name, gender, the details, the documents, probably their Aadhaar card, everything
So
gets changed. Yeah, there's a lot of legal process involved in it.
Only for this?
Yeah, body, and they should always be mentally stable, more than 18 years of age, and they should give the consent, physically motivated. Okay, they should not, as I said, should not have body dysmorphic disorder. So there are a lot of
any surgeries for them?
we do top surgeries, bottom surgeries, where we remove the breast in a female if he wants to if she wants to get converted to a male, and we put certain implants, breast implants, to make a man look like a female. Yes.
Okay. And one more myth which they tell, sir, ಈ ದೇ ಕ್ಯಾನ್ ಚೇಂಜ್ ದ ಫೇಸ್ ಓನ್ಲಿ ಅಂತ ಹೇಳ್ತಾರೆ. ಈ ತರದೆಲ್ಲ ಆಗುತ್ತಾ? ಮಾಸ್ಕ್ ತರ ಫೇಸಿಂಗ್ ತೆಗೆಯೋದು they will
No, there's face transplants have happened so far. I think around 40-50 throughout the world, in US, France, and all, where we take the facial tissues from a brain dead patient and
ಯಾರು
brain dead patient who is comatose and
they're almost
dead, almost dead. So we take their facial tissues and put it in usually people who have lost their facial features due to burn accidents or acid injuries or electrical burns or accidents and all. Yeah, face transplant is real.
ಸೊ ಮಾಡ್ತಾರೆ ಅದನ್ನ from
Yes, it's happening, and it's a very tedious and very technically demanding procedure, usually done in a bigger setup by a team of plastic surgeons who are very good in microsurgery, because we have to attach the nerves, arteries, veins, muscles. It's a technically very demanding procedure.
Okay, good. So there's one Hollywood actress by name Jocelyn Wilston anta.
Yes,
Okay.
yes.
Highest number of plastic surgery ಅವ್ರು ಮಾಡಿಸ್ಕೊಂಡಿದ್ದು because she was a face of Catwoman ಅಂತ.
Yes.
She was very famous.
Yes.
ಎಷ್ಟು ಪ್ಲಾಸ್ಟಿಕ್ ಸರ್ಜರಿ ಮಾಡಿಸ್ಕೊಂಡ್ರು ಅಂದ್ರೆ ತರ ಮಾಡಿಸ್ಕೊಂಡ್ರು, ಬಟ್ ಲೇಟರ್ ಇಟ್ ಶೋಡ್ ದಟ್ ಶಿ ಹ್ಯಾಡ್ ಡ್ಯಾಮೇಜ್ಡ್ ಹರ್ ಫೀಚರ್ಸ್, ಹರ್ ಫೇಸ್ ಅಂಡ್ ಎವ್ರಿಥಿಂಗ್, ಅಂಡ್ ಶಿ ಸೇಸ್ ದಿಸ್ ವಾಸ್ ದ ರೀಸನ್ ವಿಚ್ ಐ ಡಿಡ್ ಅಂತ. ಐ ಜಸ್ಟ್ ವಾಂಟ್ ಟು ನೋ, ಈ ತರ ಒಬ್ಬ ವ್ಯಕ್ತಿ ಎಷ್ಟು ಪ್ಲಾಸ್ಟಿಕ್ ಸರ್ಜರಿ ಮಾಡಿಸ್ಕೋಬಹುದು?
I don't have an answer for this in a very, but I would tell that repeated procedures will lead to fibrosis, plastic appearance of the skin. Over tightening or over resection, overfilling will not give you the natural proportions, natural harmony, and there is a downtime. People are probably having body dysmorphic disorder where they want repeated procedures, and there is a certain time limit for the tissues wound to heal. If you do repeated procedures, and they have unrealistic expectations. So most of the times all these factors give rise to compromised results where it looks very unnatural.
Very basic thing. Why it is called plastic surgery ಅಂತ ಸರ್?
Yeah,
people will think plastic ಹಾಕ್ತಾರೆ ಆ ತರ ಅಂತ ಯೂಶಲಿ ಅನ್ಕೊಂಡಿದ್ದು, ಬಟ್ ನಾವ್ ಯಾರನ್ನೋ ಕೇಳಿದಾಗ they think why it is called plastic surgery.
The word plastic has come from Greek word plastikos or plastine or plasticus, which means to mold or shape, and a Roman word plasti, which means to restore, to reshape. Okay, so we don't use plastic materials to perform plastic surgery, but in certain cases like maxillofacial injuries, accidents, when the bones like mandible, maxilla are fractured, sometimes now plate screws anta use ಮಾಡಿ we fix the fractures. In breast augmentation, when they opt for silicone implants, silicone is an inert substance. Okay, so we put silicone implants to enhance the shape of the breast, size of the breast. So we use certain materials, but not plastic.
ಥ್ಯಾಂಕ್ಸ್, ಇಂಥ ಬ್ಯುಸಿ ಶೆಡ್ಯೂಲಲ್ಲೂ ನೀವು ನಮಗೆ ಟೈಮ್ ಕೊಟ್ಟಿದ್ದು. ಇಷ್ಟೆಲ್ಲ ಮಾಡ್ತಾ ಐ ಥಿಂಕ್ ಐ ವುಡ್ ಬಿ ಟೇಕಿಂಗ್ ಒನ್ ಮೋರ್ ಪ್ರಾಮಿಸ್ ಫ್ರಮ್ ಯು. ದಿಸ್ ಇಸ್ ನಾಟ್ ದ ಓನ್ಲಿ ಎಪಿಸೋಡ್ ದಟ್ ವಿಲ್ ಬಿ ದೇರ್. ನಮ್ಮ ನೆಕ್ಸ್ಟ್ ಎಪಿಸೋಡ್ಸ್ಗೂ ಬರಬೇಕಾಗುತ್ತೆ, ಇನ್ನೂ ಇನ್ ಡೀಟೇಲ್ ಪ್ರೊಸೀಜರ್ ಎಲ್ಲ ಮಾತಾಡಬೇಕಾಗುತ್ತೆ. ಸೊ ನಮ್ಮ ಕಡೆಯಿಂದ ಫ್ರಮ್ ದ ಎಕ್ಸ್ಚೇಂಜ್ ರೂಮ್ ವಿ ವುಡ್ ಲೈಕ್ ಟು ಗಿವ್ ಯು ಅ ಟೋಕನ್ ಆಫ್ ಲವ್.
Thank you
ಫಾರ್ ಯು.
Thank you
Okay, sir. Thank you. You also said lot of things about ಏನೇನೆಲ್ಲ ವರ್ಕ್ ಮಾಡಬೇಕು, ನಮ್ಮ ಮೆಂಟಾಲಿಟಿ ಹೇಗೆ ವರ್ಕ್ ಮಾಡಬೇಕು ಅಂತೆಲ್ಲ. ಸೊ ದಿಸ್ ವಾಸ್ ಅ ಗುಡ್ ಪಾಡ್ಕಾಸ್ಟ್. ಐ ಥಿಂಕ್ ಜನ ಫಸ್ಟು ತಮ್ಮ ಒಳಗಡೆ ಇರುವ ಆಂತರ್ಯ ಸೌಂದರ್ಯವನ್ನು ಹೆಚ್ಚು ಮಾಡ್ಕೋಬೇಕು. ನಾನಾಗಲೇ ಈ ಪಾಡ್ಕಾಸ್ಟಿಂದ ಮುಂಚೆ ಒಂದು ಸಾಂಗ್ ಹೇಳಿದೆ, ಮುಖ ನೋಡಿ ಮೊಡ ಹಾಕಬೇಡ, ಗುಣ ನೋಡಿ ಕಡಿಮೆ. ನೆಕ್ಸ್ಟ್ ಲೈನ್ ಅದ್ರ ಹೇಳ್ತಾರೆ, ಮುಖ ಮುದುಡುವುದು ಬಟ್ಟೆ ಹರಿಯುವುದು, ಸತ್ಯ ಉಳಿಯುವುದು ಕೊನೆಗೆ. ಅಟ್ ದ ಎಂಡ್ ಆಫ್ ದ ಡೇ ದ ಟ್ರೂತ್ ಇಸ್ ದ ಅಲ್ಟಿಮೇಟ್ ಥಿಂಗ್. ಅದು ಸತ್ಯನ ಮರೆಮಾಚಲಿಕ್ಕೆ ಎಷ್ಟೇ ಮುಂದೆ ಹಾಕಿದ್ರು you cannot stop the truth. So I would like to thank Dr. Somashekar sir for his wonderful time with us. Sir, thank you so much.
Welcome, Darshan.
So next episode ge will be waiting, yaar guest bartare enu, will keep a watch, and ali tanka keep watching the exchange room. Like ಮಾಡಿ, share ಮಾಡಿ, subscribe ಮಾಡಿ. ನಿಮ್ಮ comments, complaints, compliments ಏನೇ ಇದ್ರು ಕಮೆಂಟ್ ಬಾಕ್ಸ್ ಅಲ್ಲಿ ಹೇಳಿ. So thank you so much.